Hello, everyone, and thank you very much for coming here. Thank you for your support. Thank you for all the honor that you are giving us here with your presence. Without wasting any more time, I want to invite my friend and long-term associate, Ms. Jennifer Herrera. She's from TXCDR, and she brought the good news to me few days back, which was really a big surprise, especially on the occasion of opening this community clinic. I would let Jennifer to disclose this surprise by herself. Ms. Jennifer Herrera from TXCDR.
Good afternoon, and thank you for allowing us to be a part of this special ceremony. I met Dr. Topeka 4 years ago when I was working as a director of disaster relief at a local nonprofit. And for any of you that were involved in the Hurricane Harvey relief efforts, you know that it not only takes relationships, but strong partnerships to be successful in providing disaster relief. We had a lot of families who were in apartments that were destroyed and needed a new place to stay. And we had a lot of folks that had their homes damaged and needed a temporary place to stay. And so we needed somebody that would help us with the least amount of obstacles to get these families rehomed. When I reached out to Dr. Topeka, her and her team were so accommodating and so willing to help us. And I am so proud to say that after a few years together with this partnership and many like it, we were able to provide disaster relief to over 14,400 people and invested over $6.8 million in the relief efforts. So fast forward 4 years, I always believe that people that have a heart of service find other people that have hearts of service. And so I'm so glad that our paths have crossed again. Today I'm working with the Texas Congregational Disaster Readiness Initiative, and we are partnering to find and identify communities that are underserved to be able to provide the COVID vaccination for people that still need to be vaccinated. I'm excited to report that because of this partnership together, we are going to be able to reach out to local churches and congregations, nonprofits, and apartment complexes to be able to bring the vaccine where it's needed the most. This last week, I listened to a presentation by Dr. Julie Bloom. She's the head of the immunization initiative there at Texas Children's Hospital. And she told us that out of the 127 children who have died of COVID in the United States, the two most common comorbidities and issues that impacted why they died was because they were dealing with childhood obesity and asthma. So I'm so honored that this particular clinic is working upstream to provide the prevention, the early detection, and treatment that's needed to help these families so that if they are infected, they can be able to be treated and to prevent hospitalization and death because of COVID. So we thank you for your partnership and for this relationship. We look forward to working with you, and we wish the Karya Kares Clinic many blessings and best wishes. Thank you.